Good morning, everyone. It's a great honor to be here at this important meeting. Thank you very much for organizing this session, for changing the program for me. Let's start this presentation with a real clinical case. A 36-year-old professional tennis player suffers a pulmonary embolism after giving birth, requiring the placement of an inferior vena cava filter. Now, imagine that Serena enters your hospital with a pulmonary embolism at week 38 of pregnancy. What could you do with her? Remember that pulmonary embolism represents the first cause of maternal death in the Western world. About inferior vena cava filter, we all know the universal indications. But what's known about the use of filters during pregnancy? When we consult the clinical guidelines, we find that the Royal College of Obstetricians and Gynecologists recommend the use of filters in peripartum period with an iliac DVT or recurrent PE despite correct anticoagulation. The British Society for Hematology also consider using filters for DVTs 2 weeks before delivery. The ACCP guidelines, our Bible, recommend in women with proximal DVT or PE 2 weeks before giving birth could be assessed to change to unfractionated heparin or insert a retrievable filter. They also warn us about the limited experience and the known complications of these devices during pregnancy. This group, in 2016, gave us similar recommendations, and they also highlighted the complications of filters during pregnancy. In addition, can we find any more papers about it? This review in 2016 analyzed 124 pregnancies. The authors recommend retrievable filters. However, they conclude that currently there is insufficient evidence and further studies are necessary. In 2018, this review of retrievable filters during pregnancy only found 43 cases and compared with 6,000 non-pregnant women with filters. The results show us greater complications in pregnant women. Look at what Serena thinks of these results. What data have we got in the real world to help Serena? A few months ago, Riete had 77,500 recorded patients, but only 30 pregnancies with filters. 10 with PE and 20 with DVT. For these 30 women, we have this data. In 14 cases, the filter was recovered. In 2, not recovered, and only 1 complication with a wall perforation. Sadly, the data of the rest of the cases was incomplete. When we analyze the days from the placement of the filter until the birth, we can see 57 days for PEs and 31 days for DVTs. Less than 50% are within the 2-week guideline period. As the data was incomplete, we decided to compare with the 481 pregnancies with VTE without filters. On the treatment data in peripartum period, it should be noted that in women without filter, there was a striking percentage who didn't receive heparin. If you remember, the clinical guidelines recommend using filter or unfractionated heparin. During delivery, more C-sections were performed in women with PE without filter and DVT with filter. Regarding major bleeding and intrauterine death, only 2 events were recorded in women with DVT without filter. During anticoagulation, there were more bleeding events and DVT in pregnancies without filter. And the evolution after anticoagulation, we only found a few cases of DVT and bleeding in women with DVT without filters. What are the conclusions of this very small sample of Riete? Remember, if you need to use a filter during pregnancy, always a retrievable one. With this data, it seems that they are safe and effective, but due to the lack of studies in this field, we can only recommend using filters for pregnancies with active bleeding. And finally, for me, the most important thing, we have an obligation to help resolve all these questions and more with the most powerful tool, Riete. So, could I ask you to collaborate and include more patients in Riete, please? So that patients can live happy ever after, like Serena. Again said and much, thank you for your attention.